So there are some disease conditions that could actually affect your lower respiratory tract, and they can also affect your pleural. All right, your pleural, that's the covering of the lungs, right? So they can actually affect the pleural. And we're just trying to look at the examples of these disease conditions, right? And most of these disease conditions, we have already made videos on them. All right, so making videos on them now, we are just trying to bring them together, right? Bring them together so that you can see a full list on them, in case there are people who just want to grab and all that. So lower respiratory diseases include diseases like pneumonia. We've spoken extensively on pneumonia. Bronchitis, which is inflammation of the bronchioles. Chronic obstructive pulmonary disease, that's a COPD. It could be emphysema, which is damage to the lung tissues. It could be chronic bronchitis, which is long-term. The bronchial tubes have been inflamed for a very long time. All right. It could be cystic fibrosis. It could be bronchiectasis, which is abnormal dilation of the bronchial tubes. So if the bronchial tubes are inflamed, that's when we say it is bronchitis. If it is just abnormal dilatation, that's when we are talking about bronchiectasis. Then it could be lung abscess, there's pus filling in the lungs. Do you understand? All right, so this is a picture showing pneumonia, which is there's fluid in the alveolar sacs. All right, then those are the type of disease condition that could affect the lower respiratory tract. This one here. All right, then for the pleural, diseases that could affect the pleural. We have pleurisy, which is just inflammation of the pleural. Then pleural effusion. Every student here should know what a pleural effusion is. All right. Within the pleural space or pleural cavity, there's now accumulation of fluid. Where we said that one way of trying to treat this type of disease condition is when you are trying to drain out the fluid, or if you are trying to apply something that will now cause a filling of that space. That's what pleural diseases. Okay, then pneumothorax, which is air in the pleural sac. The hemothorax, which is blood in the pleural sac. Empyema is pus in the pleural sac space. Then pleural tumor, that's basically there could be malignant or benign growth in the pleural space. Then mesothelioma is like, let me say, it's cancer of the pleural. Okay, it's often due to asbestos exposure. It's mostly in people who work in all these industries. Maybe an industry that have to do with construction, all right, they are sawing things, wood, glasses, what did I say? Wood, glasses, iron. Okay, so you are now inhaling all those small particles. It could lead to mesothelioma. All right, so those are the examples of disease conditions that will affect the lower respiratory tract and pleural.